I want to go onto my desktop. There we go, desktop. Here we go. Let's see.
I know.
Okay.
So today, Dan Bautista with Zoetis is going to be talking for us today, and he's going to go over some of the common poultry diseases that you see on broiler farms. Previously, Dan was the director of the Lasher Lab at the University of Delaware, and recently he has left and he's joined Zoetis. You'd have to tell us more about that, because that's all I have.
Sure.
I don't have a title or anything.
Absolutely. So Zoetis is one of those pharmaceutical and vaccine companies that we call allied industry, because they support the poultry industry. And so that's what we've been doing. I've been helping the industry for good 18 years right now, trying to diagnose problems out there in the field that's been submitted to the diagnostic lab. We have two excellent laboratories here in the Eastern Shore. One of them I'm in right now is Maryland Department of Ag. We just finished doing some posting sessions for one of the integrators over here. And of course, I came from Lasher Lab. The thing though is, diagnosis is one thing, but providing solutions is another thing. And that's where Zoetis is one of those big companies. Basically, Zoetis is the sister company of Pfizer. You probably heard about Pfizer, right? So we have a whole slew of products dealing with coccidiosis, basically poultry enteric disease solutions. We also have a whole slew of vaccines, from respiratory, bacterial vaccines, and what have you. So that's where I'm at. I've been spending a lot of time right now in Delmarva Poultry Farms, and I'd like to share some of the trends that I've seen over the past few months, even during COVID. So that's the reason why you see me in a mask right there on my first slide. And so, yeah, let's just keep this kind of free rolling. If I can't inform you, I'll try to entertain you.
Dan, we don't see your first slide. We see your
okay. You see it?
Yep. And if it does advance, just click on it with your mouse, and then it should start advancing.
Okay. All right. Sounds good. All right. So you see this slide right here? Okay. All right. So that's what I've been doing for the past 18 years, is supporting the industry through diagnostic testing, also education, learning a lot. I like to educate young people. This is one of the more recent ones, even outside of the state. This is Ohio State right here. But, interacting with farmers, which I enjoy a lot, growers and students as well, and interacting with primarily right now with the vets. Okay. So COVID didn't really stop what I've been doing. I just kept on doing what I've been doing for the past 18 years outside in the field. So you got some of these young flock supervisors from a company. We've been doing this for a while, doing some cocci checks. So I brought the lab to the field, my lab to the field pretty much. And that's what we've been doing. So you can see me in the orange Zoetis hat right there. We're looking at coccidia. And so I'll share some of those examples here in the next few minutes. Okay, so this is a quick visual tour of broiler disease lesions, hopefully an aid for you as growers primarily to spot early some of this disease conditions and correctly report them out to the companies so they can contact us. Not an inclusive disease. I'm not going to make a PhD out of you today. And so you have experts within the companies to talk about the details of each disease and what approach the companies taking to prevent those diseases. Okay, so let's just have fun with some of these visuals. All right, top of mind is this disease right here. So before I guess expound on it, you can see this bird right here is not happy, right? So you got this bird weeping. You see this weepy eye lesion. So you can see the tears is actually blood tinged, if you can notice that. And there's also suds in the corner of the eye. Okay, and then you can see the lower eyelid is swollen. Okay, so when you see this and the birds start to gape, this is a very good sign, a bad sign actually, that it's probably laryngotracheitis. We call it trach. Okay, so it's a herpes viral infection. It used to be a 5-10-year disease, but now, the last time we've had it for a few months now. It was 2018, which is pretty good. We got rid of it, but it got back, and so so we're trying to deal with it right now. So you can see that lesion right here, right? So it's very distinctive. So that almond-shaped eye, or we call it the football-shaped eye, weepy eye, sudsy, sudsy corner of the eye. So those are telltale signs that it could be laryngotrichitis. Okay, so you can see this bird right here. So the arrow is pointing at the shoulder, right? So those birds have a bad eyesore, sore eyes that basically they would like to wipe it. So you can see this eye wiping on the wing, which is pretty suggestive. It's not diagnostic. It's not a sure shot, but it really puts you in the ballpark that what you're dealing with is probably laryngotrichitis. Okay, so as growers, you want to watch out for those eyes. Another really important feature here is those birds could be gasping or squealing. So it's not just the eyes; it also affects the windpipe. Okay, so that's why it's called tracheitis, right? Laryngotracheitis. So a lot of these birds just crowing, gasping, squealing. Sometimes you will see bloody mucus in the walls or on the ground. Okay, so those, especially if it's pretty bad. Okay. And a lot of birds dead just because what it does is it really is a bad sore throat. Okay? It's a viral respiratory disease, and you can see it basically plugged up this bird right here. Okay, so when that happens, those birds are going to be dying within minutes. Okay, but they have been infected for a while. Okay, so the thing with the laryngotrichitis is a herpes virus. It takes 1 to 2 weeks for the incubation period to set in. What is an incubation period? Basically, it's the time from infection and the time where the bird started showing signs, start dying or starting to show some of the respiratory. So basically, when you see LT, that's the bad part about LT is you are 1 or 2 weeks late because they've been infected a while back. And the sad part is they've been shedding the virus for a while. So they've been infected for a while, as early as 1 week ago or as late as 2 weeks ago. So that's the hard part about the LT. We are 1 or 2 weeks behind whatever the first case is. So we have to go in there and vaccinate these birds with the LT vaccine. There's 2 vaccines that you growers are on right now, depending on what company you're on. One company right now is doing 100% water vaccination. So this is a live virus given at 2 weeks of age. Okay, so it's very important that the birds drink all of those that vaccine is as short a time as possible, preferably within less than an hour. Okay, and most of the other companies right now are on what they call the egg vaccination or recombinant vaccination or in ovo or in the egg vaccination. So this vaccine is given in the egg during transfer, and it will take usually 4 to 5 weeks before the whole flock is protected. So what you want to remember, if you are in a if you are in that program in ovo vaccination, that biosecurity is really important because those birds are still wide open until 4 weeks later when they develop immunity. So it's perfectly safe, but efficacy is slow going. Okay, the water vaccination, you have solid immunity in 7 to 10 days, which is great, right? But working with a live virus, if the environment is not up to par, you have high ammonia, the birds are stressed, you got wet floors, you're not blowing enough air. What could be a solution could be a problem in terms of a lot of vaccine reactions. So vaccine reaction with LT looks very much like the wild LT, depending on the extenuating circumstances. Okay, so more lesions right that I realize that most growers will not be opening up birds like this, but for the flock supervisors, they're taught to really look at those clinical signs and this lesions right here. So it could be an acute lesion like that. It's pretty moderate. Bronchitis can also look like that. But if you got blood pretty much in the trachea like this on your right, that pretty much is almost a sure shot. It is laryngotracheitis. Okay. Now, infectious bronchitis, the respiratory form, 90% of all the cases, if it's not LT, this is what we deal in year in and year out, especially if the weather turns cold. Okay, you close up the houses, the air quality deteriorates, and we are dealing with infectious bronchitis. The thing with infectious bronchitis is, this one really is paramount because when you have a lot of air sac condoms, septic condoms in the processing plant, it really is a big deal. Okay, so you have pneumonia right here. So I'm pointing, the knife is pointed at the lungs. The lungs should be collapsible. It's like a sponge, but in this case, it's solid. Okay, so that's such that I cut it, it's still meaty. So that's bad because it doesn't contain air. The lung should contain air, right? So you have this piece of hunk of cheese right here as well. Cheese is basically this cheesy lesion right here has been liquid pus for a while. So after a few days, it becomes solid pus. And so these are things that will be condemned at the plant if the bird survives this respiratory infection. Okay. You also have heard about kidney bronchitis or Delmarva 1639 strain of bronchitis. See, the thing with bronchitis, it's a coronavirus, by the way. Okay, but I will not go much into detail. This RNA coronaviruses, they are prone to mutation. Okay, so they like to live too. So we vaccinate to control them, but after a while, some of these mutants would be resistant to the vaccine we're using. Okay, and this is the vaccine that you get that your birds get definitely from the hatchery as a spray. So if your birds look blue or greenish, that's because they got the spray vaccine in the hatchery. Okay, so okay, the renal form, you got a lot of flushing. Basically, the birds going back here. I was surprised right here. I thought the grower was just pulling my leg, and he has leaky drinker lines. In this case, it wasn't the drinker line. These birds were just having watery diarrhea, and they just want to stay away from the wet litter right here. So in this case, this farm right here in Sussex County lost 1,200 birds in one day at the height of kidney bronchitis in 2011 when we found that out in this particular flock. Okay, so this particular strain of bronchitis has been around in a neighboring state north of us. And see, the thing is with bronchitis is the long-lived birds that serve as hosts for this respiratory disease. Okay, so if we're not careful about biosecurity, we will bring those into our young broilers. Okay, so whether that comes from the backyard flocks, whether that comes from a longer-lived bird like layers and breeders. So that's the reason why when we visit farms, we go from the youngest to the oldest. It really makes sense. Biosecurity is really paramount. So prevention is the key to a lot of these diseases. Okay, so that's the kidney right there. Kidney should be like mahogany brown, but you can see over here, you can see the tiger striping because it's filled with uric acid. You know, that's the white part of the poop. In this case, this is not poop right here, but it's clogging up the kidneys. All right, so what's the big deal about respiratory disease? Assume you got a broiler complex processing 1 million birds. This is why it's a big deal. Okay, it will cost this company at least $25 million in lost sales. Oops, yeah, sorry about that. Lost sales calculations excluded. So that's a big deal. That's a lot of jobs. Anytime you have a disease condition that would slow down the plant, God forbid, stop the plant, you have a lot of lost production potential over there. So look at that, 25 million. That hurts a lot, notwithstanding all of the mortality that happens at live production. Okay. All right. So factors impacting respiratory disease. I might be talking about bronchitis. I might be talking about LT. I might be talking about mycoplasma or coryza. You know, these diseases will not be so severe were it not for other extenuating circumstances. So let's just say interval between flocks. That's not a problem right now because you got big, long layouts, right? But if the going is good for the market, we tend to reduce our interval between flocks. So there's a great potential for carryover of the pathogens, so the germs from the present flock to be carried over into the next flock. That's kind of bad, guys, because the vaccine doesn't get to them first. The bacteria and the viruses get to those birds first before the 14-day vaccination. So that's not good. Okay. Bird density, immunosuppression, you know, Gumboro disease. I mean, it's all over the place right here. We try to vaccinate our breeders to get them to fight the immunosuppressive diseases, but you know, there's always some mutant strains out there that we're trying to follow. Okay. All right. So which respiratory disease? Respiratory disease like coronavirus in humans, like coronavirus, which is bronchitis in birds, they're fast moving viruses. So you can see in infectious bronchitis flocks, you can see the birds nick from one end of the house to the other within a matter of hours. That's why we have to be up to snuff also with our diagnostic tests. So we have this, what we call PCR tests. These are DNA tests that can spit out results in the next day. Really, if we're pressed for time, the results will be in by 3 hours. We have excellent labs here again in the Delmarva Peninsula. They can really respond to this disease. But the primary thing why we have those excellent tests is because of avian influenza. Okay, and the same technology is being used for Newcastle disease, that's NDV, infectious bronchitis, LT, laryngotracheitis, mycoplasma, MS, coryza, real-time PCR. So, you know, these birds look measurable. All of them have respiratory disease, different types. The one on the left, top left, is laryngotracheitis, LT or trach. The one at the bottom is early stage of bronchitis. The one at the on the right is a backyard flock, which has LT and mycoplasma and bronchitis all at the same time. Okay, so it's not an either-or situation. When you got one disease piled up on another, you see severe lesions. So, you know, that's the reason why we have to stay away from backyard flocks. These backyard flocks carry a lot of this disease. They may not die from it because they already have recovered from it, but they still shed the virus or germs periodically. That's why it's really a bad juju, so to speak, to if you're a chicken grower and you're involved with somebody who's have backyard chickens. Okay. All right. Infectious coryza has been introduced here in Delmarva over a year ago. Pennsylvania has some breaks, and we don't have the direct link, but a few months later, we found it in a commercial flock north of Sussex County. And so look at that. It's almost like this bird ate marbles, and it's in the sinuses. The reason why the sinuses is lodged in, again, you notice also there's some watery eyes as well. So that's not a diagnostic. That's not specific for LT only. Most respiratory signs would do that. But LT birds will not have, or bronchitis also will not have this puffy sinuses right here. Okay. Now this right here in the middle is also early coryza. And the reason why they're puffy in there is because they have this cheesy lesion in their sinuses. Okay. So you got a lot of these birds looking like that. Okay. So infectious coryza should be ruled out because it will cause a lot of mortality. All right, so this is me right here in that index case. I was able to go through it and say, okay, why are they having 10 per thousand mortality at 7 weeks of age? Well, because look at the one on the far right. You can see the air sac, which should be clear. It looks like a saran wrap. Looking over there. If I don't have a abnormal, I only have abnormal pictures over here. But you can see the cheesy lesions over here are bad. You shouldn't see that. You see the snot over here. If you press as well, the one in the middle, if you press the nose, you will see some frothy snot there as well. So that's bad. Okay, so the birds will be condemned in the plant if they live long enough to be processed. All right, so again, coryza, mixed infections right here. So this is a backyard bird flock here in near Georgetown, Delaware. So they were brought in. Notice the eyes again, almond shaped, sudsy air sac. I'm sorry, sudsy tears right there. So they were positive for LT. They were also positive for mycoplasma. And then we had the infectious coryza PCR at the Lasher lab a year ago, just newly minted. They were positive too. So it has been here for years. We just don't have the diagnostic test to rapidly diagnose it. So again, that just underlies the fact that if you're involved in the commercial broiler industry, you will really want to stay away, have nothing to do with the backyard flocks, okay? Because they live for years. They just carry a lot of germs and diseases, okay? So this is the layer flock right here that has that swollen face as well. And they're positive for coryza. They were also positive for other things. Okay. All right. Let's talk about 1 week mortality. So again, this is good because you can see what a normal navel looks like. A lot of the first week mortality that you guys have experienced at some point is probably due to two things. Dehydration. Birds are just not taking to the feed. They're just weak. They die from dehydration. In this case, this is not dehydration. What I'm showing you here is an inflamed navel. How do you know it's inflamed? Because of all the angry red blood vessels over here. On the left of that is a normal navel. If I don't know if you can see my pointer, but I'm pointing it to the right now. So normal navel on the left and inflamed navel on the right. And so just think about that as an open gate. So when the navel is open, then the bacteria from starting at hatch they'll be rubbing on those eggshells. They already have E. coli in there, and if they don't get infected at the hatchery, when they hit the litter in your farms, they will have E. coli. E. coli is normal in the litter. So, but the thing is, what's not normal is having a navel that's open like that. So the birds have open navels that will be prone to infection if those birds are stressed to begin with. Stressed during hatch, post hatch, during transport, all the way to early brooding. So stress is a bad thing. So you would like to eliminate that as much as possible. So when you have E. coli entering the gate or the navel, you have this cheesy lesion again. So you're getting familiar with some of this cheesy snotted lesions that I've been showing you. Basically, the cheesy lesions would indicate bacteria. Okay, so in this case, it's 90% E. coli. Okay, so the E. coli is the result. The problem there basically is that you got inflamed navels. You might have sanitation issues all the way to the breeders, to the hatch. So you don't want an egg to be smeared with any type of fecal matter. Okay, so everybody's in on this team. We're all in the same canoe, from the breeders to the hatchery people to the grow up. Okay, so it's all a continuum. Okay, so again, just training your eyes what unhealed navels look like. There shouldn't be this button navels when you get your birds. Okay, so those button navels is a sign that you got some infections coming up. So you can see when I peel these birds open, see the birds to the right, when the skin is peeled, you can see those red dots. Okay, redness like that is a sign of inflammation. Inflammation is a sign of infection. Okay. All right. All right. See this one is a little different. What I'm showing you is inside of the bird, and look at those yellow creamy dots. Okay, so that is not a bacterial infection, but the reason I want to spend some time talking about that is this is mold infection. Okay, we call it aspergillosis because that's the species that most commonly we find. Okay, so in most cases we don't find asper in our birds anymore ever since we started using this baled wood shavings. Okay, the baling process and the heat treatment kills a lot of these molds. It's only when we top dress it with some garden, you go to these garden centers and get your own bales. It may be having more softwood in there and bark that's rich with bacteria. Also, going up the chain in the hatchery, if there's if the mold count is there, it's pretty high, especially when they're doing some renovations. They stir up the air and they will have some molds. Also, when you are unfortunately, a lot of our hatcheries are around soybean fields and corn fields. So when we do a harvesting, you got this dust. So a lot of them also has mold. So the molds get sucked into those hatcheries, and we have a little blip with mold. So it's part of that annual deal that we see. So basically, there should be sanitation from the hatchery all the way down to grow out to eliminate mold. So you can see this. Mold doesn't look fuzzy like the bread mold inside the bird. It looks creamy like this. But you can see even in the lungs right here, the pink part, you can see those pinpoint lesions right there. These are all molds. Okay. Other bacteria we can find are early Clostridium infection. Again, it's another type of bacteria, but the thing is how it gets there is you got unhealed navels. Also, when you got dirty eggs coming in, it looks like derm, but it's not derm, but it's getting this bacteria Clostridium getting into that bird really from day one. Again, the unhealed navel is an open portal for a lot of bacterial infection. So that should be addressed. Also, of course, clean eggs. Okay, so what we're looking at here is this green spots right there in the liver. Okay, so it's another form of bacterial infection, like the E. coli infection I showed you. You can see the guts are very red as well because the retained yolk, which is the yolk is drained by the midgut, is infected as well during the course of hatching. Okay, all right, so you don't have to really spend a lot of time here. All right. So those birds that will survive that initial bacterial infection, okay, you are the vanguard as growers to really, after 7 days, call away those birds that are just dragging their feet, ain't doing right. you got those birds, when you open them up, they got cheesy lesions. You got to cull those because uh, to their credit, they just survive. They would run away from you. But the thing is, you don't want them dying on you at 5 weeks of age when you already fed them. They will eat you out of house and home. So that will affect your feed conversion at that point. So we call this bacterial condylar necrosis osteomyelitis. We just call it BCO. So what is that? Is those surviving bacteria, those birds that survive the first 7-day mortality, they're not heavily infected yet, but those bacteria would lodge into the bones, into the joints, into the heart. And when they started crowding up at 5 weeks of age, then they would succumb to that cheesy lesions all over the place. Okay, so that's the sad part. You fed them up to 5 weeks and then they start dying on you. So really culling is part of the process. Okay, so the industry, the companies will do their due diligence on sanitation and hatching the birds right and all that stuff. But culling is still an integral part of getting good performance out of birds out there in the field. Okay, so those birds that drag their feet, you can see this cheesy lesion right here. Those are basically bacterial infection, okay, even in the joints. That's why they're lame. Okay. Again, I don't want to pontificate too much on the chick quality issues. Again, the breeders will have their due diligence done over there as well. The hatchery, definitely. So Zoetis is also a branch of Zoetis is the Embrex machine. Okay, so this is the Innova machine. This is a robot that injects the Marex vaccine into your birds. All of the modern hatcheries in the world, definitely here in the United States, are vaccinated Innova, all the broilers. Okay, so hundreds of millions of eggs. The thing though is those Innova machines are not foolproof, so they should be treated like a surgical instrument. They should be cleaned every time they're used. So if you got poor sanitation, if you got poor use of the Innova machine, then it's not doing what it's supposed to do. Okay, so those birds are not vaccinated well. They get the bacteria introduced, not by the machine per se, but the exploding eggs are not taken away and all that stuff. That's bad. Okay, that's the reason why you got some of this bacterial infection as well in the field. So the hatchery will do their part, but in the broiler farms, those birds need not be roughed up as well from transportation and placement, brooding conditions. Those birds need to have the right temperature to not to succumb to any bacterial infection as well. So everybody's in the same boat. Okay, so again, we see a lot of these leg problems out there as well. So it's multifactorial. We try to rule out the common ones. Is it rickets? Is it calcium, phosphorus deficiency? There's a little bit of that, but this company nutritionists know what they're doing. So again, it's more of like, okay, this fast growing birds, these are like V12 engines. They would grow so fast. So at any point they don't get the required nutrition, whether that be because they're not eating like they're supposed to, feed disruptions and all of that stuff, that has an impact on leg problems as well and growth. So you can see them in a 4-week-old, 3-week-old bird right here on the right, and certainly all the way up to 7 to 9 weeks of age. So those birds will not thrive well. They will have a lot of E. coli. They'll get condemned anyway. So culling right now is the easy first option, but definitely from a company perspective, they're addressing this, and we're getting involved as well. Okay, so this is what rickets look like. Here, the normal bone that has a normal tag on it, this cartilage right here, the gray band, is replaced by bone. What happens in rickets is you don't have enough calcium from the dot. Maybe they're not eating as much, okay, but the formulation is right. But see, the cartilage right here is not being replaced by the hard bone fast enough. So these birds are lame to begin with. In this case, cocci and necrotic enteritis are also involved. So these are parasitic diseases. Cocci is robbing the bird from nutrients because the birds are flushing the feed. Okay, TD is one of them too. Again, familiarize yourself with this look right here. It's like a plastic, like a cutting board, right? So it should be replaced by bone. Okay, femoral head necrosis is almost like somebody has a bad hip. So those birds can still move, but they move with difficulty. Why is this bad? Because when those birds sit down a lot, they get bullied, they get stampeded on. You got a lot of skin scratches. you got cellulitis right here. So it's called IP in the plant. So you got septox, air sac, IP. Those are the main categories of condoms. So we don't want IP right here. Okay, certainly. Okay, some of the exotic ones out there that we find, see now your houses are closed in, so those pathogens, they like moist, dark, warm environments. So some of the things that we see is right here. See the normal tendon right here behind the shanks. It's narrow, it's slender, it's less, it's not as fat and broad as the bone, but when it becomes fat and broad right here, that's tendinitis. Okay, it's caused by reovirus. So we call it reoviral arthritis and tenosynovitis. It's a reo infection. So when I skin this, you can see it's gelatinous right here. That's why it's fat. But in a normal bird, you don't see the gelatin right here. So again, this those birds are not only lame, they're also immunosuppressed because reovirus also attacks the immune system. So it's bad all around. So some of the end results of reovirus and Gumboro disease is a higher incidence of dermatitis. And certainly some of you have seen some of that in your farms, and a lot of E. coli and respiratory reactions as well. Okay. Ruptured tendon. Okay. So this is the greenish hocks right here. Sometimes this is self-inflicted when we are pushing the birds because of good markets. We try to go for a big bird fast. And the thing is, those birds really carry weight, and this tendon snaps over here. Now, in the case of a disease situation, in reovirus, which we just talked about, that tendon right here, this narrow band, like an elastic band right here, is weakened by the viral infection, and it just snaps. It causes hemorrhage, and you got a lot of these condoms as well. Okay, so you got infectious and non-infectious cause. It's been around for a while. Most companies here, at some point in time, they vaccinate their breeders with a reovirus vaccine. So we got most vaccine companies have the vaccine. They also have what we call autogenous vaccine, which is the customized vaccine coming from virus isolated from the flocks as well. Okay, so it's not given to broilers, it's given to breeders mainly. All right, kinky back. You can see all these birds that's sitting on their legs. They're just shriveling away. We call them the Harley riders because they have their legs stretched out. They stand on their tails. So if I dissect the spine, you can see here the normal one. The spinal cord, the creamy line over there is straight, and it's not obstructed. It's not pinched. But in a pinched nerve situation right here, the spinal abscess below, in that spinal abscess right here, is pinching on the nerve. And so what you have here is the bird is paralyzed from that point downwards. So you got these birds with posterior paralysis. It's very striking. It's hard to miss. Okay. So sometimes there's a lot of them. It's basically kinky back. There's several theories about this. Most of that has something to do with basically this bacterial infections. Some of that also has something to do with transmission from the breeders. Certainly, it's amplified a little bit in the hatcheries as well. So everybody has got to pull their weight to reduce kinky back. It hasn't been a problem before with any NAE though. Basically, we cannot hide behind the antibiotics. So you see some of this weird diseases popping up. It's just that this bacterial disease is in the spine, so it produces some dramatic results. All right, coccidiosis is really one that I want to spend a little bit of time on. It's just because it's very common. All houses in the world, including Delmarva, will have this disease, will have this parasite. Okay, so any house, any commercial chicken house will have coccidiosis. It's well controlled by medication, but those medications have to be rotated so that we don't overuse them. So what I mean by overuse is this coccidia will also mutate to form resistant strains of cocci. That's the reason why an intelligent program would involve rotation of the medication. So we call it rotation, or we say, okay, we're on the vaccine right now because we're resting the medication for the wintertime. Certainly everybody except organic farms right now are on chemical or ionophores. Okay, so different brands out there. The company veterinarians determine what program they're on based on the data Okay, as a matter of fact, I just spent 4 hours this morning doing cocci checks for a company. We don't wait for this red balloon guts to happen because you might have 200 to 300 to 500 birds dead in one house. Okay, we want to be ahead of the curve, so we want to be periodically sampling these birds. But anyway, if this happens right here and you see this blood jelly-like guts, certainly in the fecal droppings, then certainly you will have dozens of birds already dead. Okay. And we call this terry towel appearance right here. The gut should be smooth and not like that. So what happens is the Clostridium will finish off the job and kill a lot of birds. So coccidia is the parasite, the bacterial infection after the coccidiosis almost certainly happens after coccidiosis is called necrotic enteritis. They basically are joined at the hip. So most necrotic enteritis after 3 weeks of age has a coccidiosis component to it. All right, so we've been talking about coccidia. This is what coccidia looks like, okay? This is our guy right here looking at the microscope. So microscopically, they look like little deviled eggs, okay? And this deviled eggs, if I send this out, the tissue for histopath, this little pillars right here, these are the intestinal villi. These are like brush borders where the gut absorbs all of those wonderful nutrients. The thing is, if they're parasitized, see those little brown violet oocysts right there, they basically obliterate the gut. So if you obliterate the absorptive capacity of the gut, then you are, if the birds live to tell about it, they will not have good feed conversion. Okay, so coccidiosis is bad news. It's been around for a long time, and we're still battling it. So it's one thing that you need to be familiar with. Though those birds at usually 21 to 28 days of age, 3 to 4 weeks, even 5 weeks of age, this is a big problem right here. So you would want instant diagnosis or immediate diagnosis, so the company can do something about it real quick. All right, necrotic enteritis, I said it's joined at the hip with is cocci. So if the necrotic enteritis is not so bad, you have a lot of runny guts. So if it's not coccidiosis, let's just say this one here is 7-week-old birds, but they still have some of this runny guts. So the company was complaining, oh, I think we're losing some feed conversion here. Can you find out what's happening? When I look at the microscope, there's no cocci, but I think this is more feed related. When you see there's some feathers here, why are they pecking at the litter and that sort of thing? So they must be missing something here. So it could be part too long of a dark out period. It could be something in the feed that's irritating the gut. So all of those had to be ruled out. And you probably, there's a lot of discussions more than you realize. The companies already almost always pay attention to this because it's costing them feed conversion. All right, derm. It's probably, some of you have seen this. Winter time, you'll see a lot of derm. Okay, so dermatitis is this clostridial bacterial infection that kills a lot of birds within 1 or 2 days when it happens. So what I want you to remember about derm is a lot of dead birds with red and weepy skin. See this wing right here, how it's weepy. When I do the rub test, I rub this, that skin will just slough off. And if I have to peel open the breast skin right here, you can see this like bloody jelly. I call it strawberry jelly and beer froth. So you see the jelly and you see the sudsiness right here. It's basically a toxic bacterial infection that fortunately doesn't hurt humans, but it hurts a lot of birds. Okay, dermatitis is secondary to a lot of things, mainly immunosuppressive disease like Rio and Gumboro. Okay, also if your floors are always wet, then the Clostridium would just bloom and you have a high clostridial challenge as well. Okay, so the thing about dermatitis is that you grow those birds, they're perfectly healthy at 5 to 7 weeks of age, which we call the derm window, and then they start to die in the hundreds. That's not a good thing. Okay, so keep an eye out for your litter and maintain litter quality, and obviously the vets will do their job picking out the good anti-immunosuppressive program, if you will. All right, this happened in July, so this is heat stroke. It's still red, but it's not derm. Okay, It usually happens obviously in warm weather, but even in the fall or even early winter, if you have a house that's too stuffy, remember these birds do not sweat. So if they do not sweat, if you are warm, those birds will be doubly warm because they don't have sweat glands like you do. And so the hallmark of heat stroke is this blotchy, pale, and red breast right here, and a lot of dead birds. Usually the ones that are big, and usually the ones behind the migration pens because they have some dead spots. So eliminate dead spots in those houses, especially the big houses. Okay, so you got to move some of those air, especially in these big birds. Remember, they are emitting a lot of heat. They're eating a high calorie diet, and they're growing so fast. So there's not a whole lot of at this age. There's not a whole lot of reasons or a risk for the birds to be chilled, but there's a whole lot of opportunities for them to be overheated. Okay. All right. Inclusion body hepatitis. We call it IBH. It has a very distinct liver appearance. We call it reticulated, or it's almost like net-like. So it also affects the liver. So if the liver is affected, and it will show jaundice or yellowness. So it usually happens between 3 to 4 weeks of age. Sometimes it gets carried. It gets carried from the virus. This is an adenovirus. It gets carried from the breeders to the broilers. So if it happens very early, probably is caused by a breeder farm that still is shedding the virus and it's showing up in the broilers. So usually those are the young breeder farms that haven't fully developed their immune system. Okay. But they'll get over it and it will just disappear. That's the reason why you have IBH in one flock right now, and then the next flock, nothing. Okay. It also can set into the floors, but if you got a good a program that controls for a lot of this immunosuppressive virus, you won't see it again. But certainly begs the question, if you have IBH 2 or 3 flocks already, then it's something that your veterinarian needs to pay attention to see if this is a variant strain or a mutant strain that your birds or the company is not protected against. So the birds will not be vaccinated, your broilers will not be vaccinated, but certainly the breeders will be if it is indicated or is needed. Okay. All right, Marek's leukosis. So this is almost like chicken cancer, right? But this chicken cancer does not cause human cancer, but it's strictly a chicken disease. So I got a veterinarian that walked in with a dressed chicken. Obviously, this is not a live chicken, came from the processing plant. He's not happy because there's a lot of condiments. And lo and behold, the liver, you see some of this creamy meat-like lesions. They're basically tumors. Okay, so tumors equals Marek's leukosis. So that's bad. Usually, this is caused by vaccine failure. Okay, we vaccinate those birds each and every check with the Marek's vaccine through the Innovo machine that Zoetis has. Okay, so we pay particular attention to how those machines are maintained. It's incumbent on the company to make sure that the vaccines they're given are basically not inactivated by heat. We don't want them to be in room temperature for long. So there's a lot of protocols for this not to happen, but it happens once in a while. So that's costing the company a whole lot of money. So this is not something you can see on the farm, but it shows up on the processing plant. And mind you, if it happens like this, everybody will notice. All right, the spotted liver disease, this is something new, especially in chickens with outdoor access. This did not happen in Delmarva, but certainly happened in the Carolinas. Obviously, we don't grow red birds around here, but it killed a few hundred chickens, and this came from a picture from one of my colleagues, Dr. Andy McCree. So, with outdoor access, these birds are, drinking on puddles, that sort of thing. This is something to watch out for. Okay. All right. I don't know how we can do this quiz right here, but I will do it anyway. And which liver has IBH lesions? We talk about IBH, so I'll give you 5 seconds while I'm talking about it. So we talked about liver lesions with tumors on it. We talked about some of the pinpoint lesions that we just saw, so the answer is letter C. Okay, IBH, caused by an adenovirus it could show up because the birds are immunosuppressed or young breeder flocks have not been immunized yet by properly. So it will show up, but it will go away. All right, rickets. Rickets is caused by calcium deficiency. It could be because there's there's a feed interruption while the birds are growing very fast from 4 days all the way up to 21 days. So you don't want any interruption. Okay, so letter B is rickets right here. Letter A is TD, which is also kind of related. When the birds are growing fast, and these birds are bred to grow fast, you see a lot of TD as well. So it's nice to see some TD, but you don't want to see a whole lot of TD, letter A. Okay, we're still in the business of growing birds fast. Okay, but not at the expense of leg problems. Okay, letter C is basically a ruptured. So that's a bad hips. We call it femoral head necrosis. The femur is the thigh bone, and basically you just lost the head of the thigh bone right there because there's a bacterial infection. So this is more related to hatchery conditions and breeder sanitation, that sort of thing. Okay. All right. Finishing off where we started. We talked about LT. It's front and center in our minds. Which eye has LT? Okay. So again, we're talking about almond-shaped eyes or football-shaped eyes, pus, watery with blood-tinged tears. That's some of those hallmarks of LT. And certainly, if you chose letter B, you're right. Okay, this is not one thing that you want to be so good at. Hopefully, you don't have to experience LT. But if you did, you couldn't forget it. Okay, LT is one of those things. One good thing about one diagnostic tool for LT is that those birds will have a severe drop in water consumption. And so just be inside those houses, be looking at those eyes just with a flashlight. And hopefully you don't have it, but at least you can diagnose it. Remember, with LT, the incubation period is working against us. So it's really important that the farmer and the flock supervisor and the company coordinate so that they can diagnose LT real quick. So if you got a decrease in water consumption this winter, this is one of the things you want to rule out real quick. And with that, I thank you very much. I apologize for the delay a little bit, but I think we made it through. I'll hand it back to our hosts for questions and whatever comments you might have.
Thanks, Dan. We really appreciate that.
Thank you.
We know how logistics go, and everything doesn't always go the way you plan now, does it? But we really want to thank you. Excellent overview on the basic diseases and some that we see here commonly. Do we have any questions in the chat box? I don't see any, but I do know the people that did answer the disease, which ones were pretty good. They was watching the chat box.
I even got 2 right.
Well, Maureen, you didn't put it in the chat box, so therefore you don't count.
What? Hey, I was multitasking. I was making my salad while taking a test. I think that's pretty impressive.
They can turn their mics off if they want to ask Dr. Bautista any questions.
Yeah, there's enough of us.
Go for it.
There's few enough. If anybody has a question, just go ahead and turn your mic off, raise your hand. We'll get you off some way.
Good afternoon. I had a question for Dr. Bautista. I was recently told that having acid alum or A7 or whichever form, it actually helps with the leg issues. Is there some truth to that? And then the other part of my question is it for the diseases that stay in the litter, does it help one way or the other with PLT or alum to spread those through the whole house, especially in these winter flocks, to help with those challenges?
Sure, good question. So yeah, Mr. Nasir, yeah, thank you for those questions. I'm kind of thinking, so leg problems, there's nutritional causes of leg problems, and then there's or infectious causes of leg problems, right? So let's go. I don't think this is pertains to nutritional if you're talking about litter amendments. But I'm thinking what they're saying indirectly is that if you got good litter management, either by definitely ventilation is certainly one of them, but with litter amendments, basically what you want is you don't want caking, you don't want high litter moisture, and because those are bad for a lot of reasons. They got a lot of bacteria and viruses that are living in moist litter. So if you reduce that using litter treatment, you are doing yourself a lot of favor. So not just on the lameness side. Yeah, certainly some of this bacterial lameness could be caused by E. coli bacteria. Now we call it BCO. Okay, but certainly the reovirus, if you got you got better conditions in there, I mean, would have less impact as well. So it's more on the infectious disease causing lameness that has an impact. So I can see that. I would agree with that, but will not probably have an impact on, like, say, rickets and that sort of thing. However, having said that, though, again, I would like to reiterate that most of these diseases has to be addressed holistically. So, once there's a correct diagnosis and the powers that be in the company knows about it, then they will do their due diligence where they're at, hatchery breeders, that sort of thing. Of course, this is a grow out program right here. You have a very important role as well to mitigate some of this disease, like we talked about. We couldn't overemphasize ventilation, right? We couldn't overemphasize litter quality, which is basically saying the same thing, because when you ventilate, you're taking away all of that moisture out, or most of that moisture out. That's the only way you can take the moisture out of that litter, right? So that's better than I do. So yeah, so that's a long-winded answer, but hopefully it kind of touches on what you ask.
Are there any other questions?
Thank you.
Thank you.
Thanks for joining us today, Far. I didn't see you down there. Anybody else have a question?
I've got a question. I cut a bird open about 3 weeks ago. He had a lot of yellow water in him, which I knew what that was, so I wasn't real worried about it. But when I pushed on his belly, I had a fist-sized lump of dark green jelly came out. And I couldn't get an answer as to what that was.
Okay, good. That's how many birds show that sign?
Just the one that I cut open. The rest of them, they had E. coli.
Okay, yeah. So I'm guessing that would probably what we call water belly. So water belly has a lot of watery, amber-colored, straw-colored fluid in it. But certainly sometimes what happens is you see this gelatinous, yellowish deposit in there. What basically that is?
It wasn't yellow. It was dark green, like mint jelly.
Dark green. Okay. The dark green probably something else. It probably is blood that has started to deteriorate. So it's probably like a blood clot from bright red starting to become green and later on dark. So it probably is like well, have you heard about aneurysm? So aneurysm is basically you got this blood vessel that's about to burst, right?
Yes.
So if it's ruptured, so it's basically a ruptured aneurysm. So what happened there is you got internal hemorrhage. And so it happens, especially in the birds that are big. If you got birds, fast-growing birds, that's a little bit of a stress. If it happens often enough in more birds, then maybe we need to slow down what we're doing, or maybe not stimulate the birds too much.
It's the first time I had seen it, so I thank you for your answer.
No problem.
Anybody else? Well, if there's no other questions, we want to thank Dan again. Give him a big air clap.
Thanks,
Thank you
Dr.
very much.
Dan.
No problem.
Thank you.
Yes, ma'am. My
Thanks, Dan.
pleasure. Okay. Well,
Thank you.
enjoy the rest of the afternoon now.
Hey,
Too.
Dan,
Thank you.
Dan, are you
Thanks,
correct?
guys.
Call?
What's that, John?
Can I give you a call in a few minutes?
Absolutely. Yeah.
All right.
Thanks,
man.
guys. See you out there on the farm. Certainly, always a pleasure to be interacting with you.
All right,
Oh,
thanks.
thank you.
Thank
Bye-bye.
you.
Bye-bye.
So Sheila, you recorded this. This will be posted and people can go back and review this, correct?
Yes.